Welcome everyone to the latest webinar with Cosmetic Laser Dermatology. We are here today to talk about Cool3 and CoolSculpting, which is one of our favorite non-surgical treatments for body contouring and sculpting. And Cool3 is a proprietary treatment only found at Cosmetic Laser Dermatology. Not only are we going to tell you about those treatments today, but we're also going to explain our new pricing structure and financing opportunities that really do make CoolSculpting and Cool3 more affordable than ever. So perfect timing for summer. So before we get into the presentation, let me just introduce you to your two amazing speakers today. So this next slide, we have, okay, go back one slide, sorry. So before we get into introducing them, this is the entire Cosmetic Laser Dermatology team. I hope you guys know many of them. You can see beautiful Leysin is there. But everyone else, these are our board certified dermatologists, as well as our medical esthetician, Farzaneh. And all of our doctors love CoolSculpting and recommend it. But Leysin is our in-house CoolSculpting master, and she does pretty much all of our CoolSculpting treatments. So let me introduce you to Leysin. So Leysin is an amazing physician assistant, PAC, and she has had 14 years of experience with CoolSculpting. Do you guys know how long that is? That's probably more than anyone else, because that's pretty much right when the device came out. So Leysin really brings a ton of expertise and experience with CoolSculpting to the table. And over those 14 years, she has definitely treated at least 500 patients. And since every patient gets multiple treatments, we're talking thousands of treatments. So we really do have a lot of experience. Also at CL Derm, we're really proud to have not just one CoolSculpting Elite, but two CoolSculpting Elite machines and the brand new Cool Tone machine. So we're one of the only offices in the area that have all three of those combined. And we're going to tell you a little bit about how we use them together. So after Leysin, I would like to introduce you to Desiree, and we're so grateful to have Desiree here today. She is our CoolSculpting partner. So she is actually has been working with Allergan, the maker of CoolSculpting, and with CoolSculpting for 8 years now. So she really knows what she's talking about, and she has seen all of the practices local in San Diego and what they're doing. And I'm really excited for you guys to hear from her about what makes cosmetic laser dermatology and Leysin stand apart. So without further ado, let's get into it. And we're going to start off with Desiree.
Hi everyone, welcome. I know it's always hard to get on these things after a holiday weekend. So we're so grateful that you're here to spend your evening with us to learn a little bit more about cosmetic laser derm and CoolSculpting. So I'm gonna start off with a little bit about the history of what CoolSculpting is. As you can see in this picture, it's a popsicle. It all starts from the popsicle. So basically where the science behind CoolSculpting came from was that there was some clinical studies that were done in the 80s about women that were taking their babies in to the emergency room who were sucking on popsicles. And they were noticing that there was some dimpling of the tissue on their inner cheek. And then there was also a study going on with equestrians who are riding horseback in the winter, and they were seeing a reduction of tissue on their inner thigh. So what Dr. Rox Anderson came up with is that there was a correlation between freezing cold temperatures and the reduction of fat tissue. So that is where the science behind CoolSculpting came from. It's called cryolipolysis, cryo meaning freezing, lipolysis meaning the reduction of fat. So essentially how this treatment works is we place an applicator on your tissue. We do have protective supplies that go over your tissue to prevent any freezer burn or anything done from the cold temperatures. They do range from -10 to -13 degrees Celsius, so they're very, very cold. Once we engage the applicator, you'll feel a little bit of tugging from the vacuum, and then we engage the cold. So typically for the first 8 to 10 minutes, you'll feel a little bit of pinching, a little bit of burning. I like to say it feels like when you go from the snow to a hot tub, that sensation, but that goes away within the first 10 minutes. So the remainder of the treatment, you don't feel anything, which is pretty amazing. The applicators and the treatment times range from 35 minutes to 75 minutes, depending on what size applicator you're using. And like they mentioned earlier, because they have multiple systems, we are able to treat different areas of the body at the same time, which is going to cut your treatment time in half. So this is just a little visualization of what happens to your fat cells during CoolSculpting. So the first picture is just someone with their fat cells, right? You come in, we start the treatment, and once we start that treatment, we're already triggering the cryolipolysis, or the freezing of the fat cells. Now, this is a progressive treatment, so you're not going to just walk out and have the fat cells gone. It's gonna get better over time. So most patients can see results as soon as 30 days, full results at 90 days after the treatment. We do recommend a minimum of 2 sessions, but some patients get such amazing results that they come in for more than 2. But we do recommend a minimum of 2 to get those amazing results. With each treatment, it's up to a 25% reduction, and this is a permanent reduction. So we are permanently killing fat cells, which is pretty amazing. We are cleared to treat 9 areas of the body, and this is FDA cleared. What it is, by having the FDA clearance, it's showing that you're going to get safe, efficacious results from this treatment. And we are cleared to treat everywhere from the chin to above the knee and everywhere in between. So we have the abdomen, the whole back, the inner outer thigh, the distal thigh, which is above the knee, the banana roll, the bra fat under the arm, and then the whole under the chin area as well. And then just a couple little things about what sets CoolSculpting apart. Ever since we launched the device in 2009, we have always been the #1 treatment for non-invasive fat reduction. So since we launched, we were #1, and now in 2024, we are still #1, which is pretty amazing. We've done over 13 million treatments worldwide, and we have over 100+ publications on the clinical efficacy of the treatment. This is a non-surgical treatment, and there is little to no downtime. So Leysan's going to talk a little bit about the Cool3 that we offer.
Good evening, everyone. My name is Leysin Fletcher, and I am the physician assistant and master CoolSculptor here at Cosmetic Laser Dermatology. And as Risa and Desiree noted, I have been personally performing CoolSculpting for 10 years. I've worked with 3 generations of the CoolSculpting devices, and I am so excited to be working with the CoolSculpting Elite. At our practice, we have a proprietary Cool3 treatment, which I absolutely love, and I have appreciated the results on all of my patients that we use the Cool3 treatment. So CoolSculpting is the first portion of our Cool3 treatment, where we actually freeze the fat cells. And then at the end of the cycle, the fat cells are in their most vulnerable state. So we need to massage them in some way, shape, or form. A lot of practices will manually massage that tissue. In our practice, we have a specific device called the Zimmer Z-Wave, which is an acoustic wave radial pulse technology device that will actually go over that area that has been frozen for about 2 to 5 minutes to start that process of elimination. And then to take it one step further, the Cool Tone is something that we like to incorporate into our treatments as well, which is a muscle magnetic stimulation device to build the muscle underneath. So if you can imagine getting rid of the stubborn fat cells, building that muscle underneath, it just really enhances the aesthetic outcome of our procedure. Now, the Cool Tone can be used on the abdomen, the thighs, and the buttock. We love the Cool Tone at our practice. It does enhance our outcome of our CoolSculpting. Cool Tone can also be done separately on its own just to build muscle. It is typically a series of 6 to 8 treatments in any of those areas. But with the CoolSculpting, the Cool3 is definitely proprietary to our practice, and we're happy to offer that to our patients.
Great, I love it. And like Leysin said, this is one thing that really differentiates this practice against everyone else, is because it's a one-stop shop. You gotta get rid of that fat and build the muscle in one place. And they have a beautiful treatment room that it's a 5-star treatment, especially with Leysin performing it. And you couldn't be in better hands. So part of this treatment is it's all about you. We really want to sit down with the patient and learn what their goals are, right? Like, are you at the beginning of your weight loss journey? What is your hope? Are you hoping to, fit into a dress for your daughter's wedding, or just starting the weight loss journey? Or are you hoping to lose a couple inches before your vacation? So this is really about the patient and finding out what their goals are. So we work with them to create a personalized treatment plan. This is, being able to look at your areas of opportunity, create the customized treatment plan for you, and then be able to book your treatment and give you the results that you want. Usually with your personalized treatment plan, like I said, we'll assess the area, we'll come up with your customized treatment plan, go over pricing, go over what your treatment schedule is going to look like, and then you'll come in and you'll do the treatment. And like I mentioned, what to expect during the treatment, I'll go over it again briefly. You'll get that. We'll start, you'll engage the cold. You'll feel a little bit of that prickling, a little bit of that burning. Then for the remainder of the treatment, you won't feel anything. At the end of the treatment, we do engage a 2-minute massage. And this is just to help bring blood flow back into the area. What you can expect after the treatment is a little bit of tenderness, a little bit of redness, a little bit of inflammation and numbness. So all of that stuff is temporary. And like I mentioned earlier, there is little to no downtime with this treatment. So a lot of people ask, like, do I have to take time off work, or what is it? And this is truly a lunchtime treatment. You can come in, go back to work that day, or go back to work the next day. Some people even work out that night. So it just really depends on your comfortability, but this is truly a non-invasive treatment. So like I mentioned earlier as well, when you'll see results. So some patients will see results as soon as 3 to 4 weeks, and then full results at 90 days. So if you're coming in for those 2 sessions, you'll essentially see full results at about the 5 to 6 month mark. So like I said, it is a progressive treatment. It's one of those treatments where you're like, I don't know, is it working? Is it working? And then you put on your skinny jeans and you're like, okay, it's working. And also we take pictures of your whole progress. So then, pictures don't lie. You'll really be able to see the results. And we'll go over some of Leysin's pictures of her actual patients in a little bit here. Okay, do you want to go over these?
Yes, so this patient actually had a very nice result. She was concerned about her tummy and her clothes not fitting very nice. She actually had 2 treatments. This is before treatment. This is 3 months after her second treatment. Very, very happy with her results. Again, here's a patient. She, again, was looking to get a flatter stomach. We treated her abdomen, and she had 2 treatments as well. And this is another very nice result. This particular patient is an older patient of mine who was just not happy with the way her clothes were fitting. She was looking just for her clothes to fit nicer. And she is very happy with this outcome here. She had her abdomen and her flanks done, and she had 2 treatments as well. This is the same patient. Now, this patient, we did her flanks, front, two on each side, so her posterior flanks, and we treated her twice as well. And you can see the nice slimming effect kind of helped bring back her nice hourglass. Very, very happy with her results. This patient here was looking to slim her abdomen, and she only had 1 treatment, and you can see her outstanding results. This patient here had abdomen and flanks done. She had 2 treatments there. Happy with her results. But again, with our new program that we're launching tonight, I think we could almost do a 3rd treatment on this patient and she'd be even happier. This patient had her flanks done, and you can see she had a nice outcome as well. This patient had abdomen and flanks done. She had one treatment. I think she could have a second treatment and get even better outcomes. She was thrilled with one treatment. This gentleman actually did our proprietary Cool³ procedure at our practice. So he had 2 treatments to his abdomen and flanks with CoolSculpting. And then he actually did a series of Cool Tone in conjunction with his CoolSculpting procedure. He started his first Cool Tone right after CoolSculpting, and then he came in for his series of 6. And he was thrilled. Outstanding, nice reduction of the subcutaneous tissue, followed by much more definition in his abdomen. Here he is again. And this is him again. This patient was not happy with the way his jeans were fitting. You can see he had a little overlap right around the belt area, and he had 2 treatments, and he is very happy with the way his jeans fit. I actually do have patients bring in their clothes that they're looking to fit into. We can photograph just as we did here to show the nice improvement that this patient had. This patient here had her abdomen treated twice, very happy with her results, nice slimming effect. Now, this is the back. I love treating the back. The back really does make a big difference. So if you happen to be working out, your sports bras will fit nicer, your dresses will fit nicer. You could see the nice slimming effect. She had one treatment here, and she was going to progress into her second treatment as well. So very nice outcome of the back. This is all down the back. This patient had her abdomen and flanks done, and she had one treatment. You can see she had a nice improvement after one. And again, she was going to go in for a second treatment. This patient here had her abdomen done after one treatment. Nice slimming effect, flatter abdomen. Another abdomen. This patient had her abdomen done as well, and she definitely has more definition and less volume as well after one. Another abdomen, and this patient had her flanks done too. So abdomen and flanks, she had 2 treatments. You can see nice improvement there. And this patient the same. She was looking for her clothes to fit nicer. We were able to devolumize the abdomen. She was very happy with her results. Her clothes fit nicer, and she's on to her weight loss journey. This patient had her abdomen done, so we did 2 treatments to her abdomen. Very nice outcome here. Same patient, yep. The arms happen to be one of my favorite areas to treat. They happen to be hyper responsive, so they respond very, very well. This particular patient had one treatment, and you can see a nice reduction in the arm subcutaneous tissue. This patient again had her arms done. She did one treatment, very nice outcome. And inner thighs, another area that we treat. You can see that this patient, she had 2 treatments to the inner thighs, nice improvement there. Outer thighs, so you can see out on the outer thigh, you can see a nice improvement there. This was after 2 treatments to the outer thighs. Same here, outer thighs, nice reduction after 2 treatments. The chin area, the submental area, this is a nice area to treat too, as long as it's not too much volume there. This patient had 2 treatments. You can see she has more definition. Sometimes we even like to treat along the jawline to overlap underneath the chin to get volume reduction, and it'll actually help kind of tighten along the jawline a little bit in certain patients. Again, so, yep, that's good.
Okay.
So we're very, very excited to be a part and have been invited to be a part of the pilot program for CoolSculpting. Our practice has been doing CoolSculpting for many years since the beginning, and we are able to offer our patients reduced pricing. Now's the time to come in, get reassessed if you've been assessed in the past. Our focus is on outcome and not applicators. We want to treat you to completion. We want to give you those results, and we're able to do it with a significant reduction in our previous pricing. So we'd like to invite each and every one of you to come in, be assessed. It's a complimentary consultation. I will spend time with each of you, go through your goals, come up with a customized treatment plan, and get you treated to completion. We do have financing available in order to assist you with accomplishing your goals. Even for as low as $278 a month, we can get you treated. We've got care credit, we have Alpheon, and our goal is to get you to where you want to be.
We also, since we were part of the Allergan umbrella, both Cool Tone and CoolSculpting, you will accrue Allergan dollars to be able to use on any of the portfolio products. So on Botox or filler, or either of the treatments. So that's also a nice perk. You get money for spending money, and then you get to use that for more treatment. So that's always fun. And that's it. So we will start the question portion.
Beautiful. Great job. All right. So everyone, this is the time to start popping in your questions. And we already have a bunch of these already. Anything else you want to ask Desiree or Leysin or both, feel free to pop them in. All right. So let's get started. So this is a great question, actually. How do you know if CoolSculpting or liposuction is a better treatment for you?
I can speak to that. So in our practice, we do offer liposculpture as well. So I am very well versed in assessing patients based on the volume of tissue that they have. And I always go through your different treatment options that you have to accomplish your goals. It is best for patients. CoolSculpting is best for patients within about 10 to 15 pounds of their ideal body weight. But with that being said, if you're a patient that absolutely is not interested in undergoing a surgical procedure, then CoolSculpting can be an appropriate choice to help devolumize an area and get you onto your weight loss journey to accompany your exercise goals. So I always go through all of the treatment options with my patient, including liposculpture, which is something that we offer with our board certified dermatologists and cosmetic surgeons at our practice.
Yes, I love that. Thank you so much. And just so everyone knows, not only do we offer liposuction, but we actually have a fully accredited OR on site. So we do it right in our practice. And, you know, Leysin, maybe you could tell people what are some of the other treatments around skin, skin tightening and body sculpting and facial sculpting that you may recommend, just so people realize everything that they can talk about when they come in for a consultation with you.
You know, oftentimes patients are concerned with skin laxity. So we offer a variety of non-surgical skin tightening devices like Thermage, which is a radio frequency device, Ultherapy, which is an ultrasound device, and then Softwave, which is the latest in ultrasound technology for skin tightening. Sometimes it's not just addressing that subcutaneous tissue, but it's also addressing the overlying tissue to tighten things up. So we like to combine a lot of our modalities in our practice to give you your best outcome. So that, you know, and of course, those non-surgical modalities can be used not only on the body, the skin tightening treatments, but they can be used on the face, the neck, the chest, everywhere.
So it wouldn't be uncommon for you to recommend, let's do CoolSculpting here and Thermage there, and like different treatments for different areas.
Correct.
I love that. So see, guys, that is a big differentiator with cosmetic laser dermatology and Leysin. All right, this is a great one. Will I have loose skin after treatment?
So depending on the areas that are treated and the age of the patient, the amount of skin laxity that is there to begin with, I typically advise my patients, if you have skin laxity there to begin with, it will typically remain there. Oftentimes you won't see additional skin laxity. In fact, with the CoolSculpting Elite, we've actually seen some tightening of the skin in that area, in the areas that we treat. because it does combine cool and heat with the CoolSculpting Elite technology. So I don't expect a lot of additional skin laxity with CoolSculpting.
I love that. So, all right, we have two questions similar about, is there an upper age limit for good results? And, are there any concerns with treating someone above the age of 60?
Not at all. Anybody is a candidate. So we like to say, if you can squeeze it, we can freeze it. So it doesn't matter how young or how old you are, everybody can be treated.
So even someone like 75 years old?
Absolutely. Yes.
And down to someone that's 20 years old?
Yes.
Love that. All right. How long do the results last?
The results are permanent. Typically, if you were to gain weight down the road, it oftentimes will go somewhere else than what has been CoolSculpted, but they are permanent results.
Yeah, I love that. So this is a good question. I've been told it takes more than 1 to 2 times to see results. Is that true?
A minimum of 2 treatments, and your assessment, your complimentary consultation, I'll be able to give you a good idea. Patients see good results at 2. I have a lot of patients that continue to want additional improvement and go on to a 3rd and 4th treatment.
And the more
all of it depends on the amount. The more treatments, the better. Exactly.
Yeah, and we like to put it into 2 buckets, like the sculpting patient. So someone that's really close to their desired weight, just wants to lose a couple inches and get toned. And then we have our devolumizing and sculpting. So maybe someone new to body contouring that has that extra layer of tissue. We have to get rid of that tissue first before we can start the sculpting process. So that would be someone that would fall into more sessions.
All right. So here's the questions. Sorry if you answered this already, but how painful is it?
It is not painful. Typically, the 3 to 5 minutes, you'll feel a gentle tug from the applicator, the vacuum, and you'll feel it get cold. And just when you feel that sensation of cold, it'll go numb for the remaining portion of the treatment. And then after the treatment has completed, we remove the applicator, and you may feel like if you've ever gotten skied or snowshoed and your toes or hands have gotten real cold, that kind of burning sensation that you feel initially for maybe about 5 minutes right after we remove the applicator, and then it goes away.
Got it. So I'm glad someone asked this, but what about the complications? Have we seen a lot of complications in our office? And if there is a complication that comes up, what are we able to do to fix it?
So occasionally patients will experience nerve-like pain after treatment. I have really only had maybe 3 patients in all the years that I've been performing this treatment. If it does happen, you'll know, because your discomfort is not relieved by Tylenol or Advil after treatment. And we notify all of our patients if they experience this discomfort after taking Tylenol or Advil to give us a call, and we can call in a prescription for gabapentin or Neurontin, and that discomfort goes away immediately. But again, that is a very, very rare occurrence. I'm having to dig deep here because really there aren't any
someone said a stick of butter
complications. Now, paradoxical adipose hyperplasia is a big word for basically the fat cells expanding. The risk of that is 1 in 15,000 patients can experience that. Have I had that happen in all the years that I've been doing CoolSculpting? I can say, yes, I have. I have had 3 cases of that. We don't know why. We don't know, it's not more common in males or females or certain ethnic backgrounds, or we don't know why it happens. The company doesn't know why it happens, but I will say Allergan has an outstanding program in place that will take care of a patient if this happens. So we send over our treatment plans, our photographs, our confirmed diagnosis that this is in fact paradoxical adipose hyperplasia, and they will actually compensate the patient to have corrective liposculpture to correct this issue. And it is 100% correctable. The 3 patients that have experienced that that I've seen have had complete success with the liposculpture, and they're living happily ever after. So that's the lovely thing about Allergan with their program that they have in place for this. But again, 1 in 15,000 patients. I've only seen it 3 times. I don't expect anyone else to be the 4th.
But I'm glad we're being so transparent about it. And I think that's another reason why it's helpful to come to a place for CoolSculpting that also offers lipo, because just in case, God forbid, it does happen, like you said, we have all the tools and techniques and providers to fix it completely. All right. What are the package prices, and are there any price ranges that we can share?
So
I think,
go
go on.
Go ahead, Desiree.
Yeah, I was just going to say, like I said earlier, this is a completely customizable treatment. And so first of all, we really, really urge patients, if you're interested, to come in for your consultation. First of all, we want to make sure that you're a candidate. That's the first and foremost. Second of all, we want to create that customized treatment plan for you. So the great thing about it now is it's not a la carte pricing. You come in, if you want to treat your abdomen or you want to treat your midsection, we really only have 2 options, right? You're either that sculpting patient or you're that devolumizing and sculpting patient. So really, we like to leave the prices for when you come in for that consultation. But no, with this new program, there is a lot of savings from what we used to be charging.
Yeah.
That's amazing. And that's one of the reasons why we offer complimentary consultations with Leysin for this. So, Leysin, what about if someone lives out of state? Could they somehow do a virtual assessment with you?
Sure, we can do a virtual assessment and have you send photos over, and we can take a look at the photos and review them and come up with a treatment plan together. Absolutely.
Yeah. And just so you guys all know, we have a lot of patients that fly in from all over the country and even all over the world. So we definitely can accommodate you with that. We have special rates at certain hotels if you need us to help coordinate. But we have a lot of people flying in. All right. Does CoolSculpting or Cool Tone affect your muscles at all?
So Cool Tone is going to build muscle in the area that we treat. So for the abdomen, so it will cause your muscles to involuntarily contract for 30 minutes. And these are muscles that you're not able to normally recruit on your own with regular exercise. So it will complement your regular exercise routine. Otherwise, there's no negative effects to Cool Tone or CoolSculpting on the muscles, all positive.
Okay. And do any skin types have different side effects from CoolSculpting?
No.
CoolSculpting works on any skin color, any tone.
Any skin color, any tone. Yes.
All right. What if I'm tan over the summer?
You can be tan. There's no, it's colorblind. So it's only treating fat.
Yes, I love that. And just so you guys know, this next month of July and August, these are always the busiest 2 months of the year for CoolSculpting. This is when everyone's thinking about it. So you've come to the right place if you're here. All right. So if anyone has any last questions, let us know. Otherwise, I have one more. So will you just go over how is our process of doing CoolSculpting with Cool3 different than all the other places that say they offer CoolSculpting?
So that is incorporating the Zimmer Z-Wave into the treatment instead of the manual massage. So as part of the CoolSculpting, you perform the CoolSculpting, and then when those fat cells are in their most vulnerable state, you need to break them up somehow in some way. So most practices will use their hands to manually manipulate the tissue to break those fat cells up. We have chosen to use the Zimmer Z-Wave, which is an acoustic wave device to break those fat cells up. And then in certain situations, we can incorporate the Cool Tone. So in the abdomen, if patients are treating the abdomen, I love to add the Cool Tone in there because that's going to actually give a better outcome. Even for the outer thighs, if you're going to treat the outer thighs along the outer thighs, inner thighs, banana roll, we can incorporate the Cool Tone onto the buttock to kind of help lift in the buttock area, and it'll help enhance the outcome of the total thigh package. So that's where I like to incorporate it. And that's what sets us apart by incorporating the Z-Wave and the Cool Tone.
Yes. And that you cannot find that anywhere else, guys, in the whole country, just here. And I think, with Leysin. So how, someone's saying there's a 50% CoolSculpting complete treatment package, right?
So the 50% is
Off.
off. It's a reduction in our pricing, which is up to 50% off of our previous pricing that we have had up until now, which is exciting.
Which is amazing.
Amazing.
Everywhere else we go, they're raising prices, right?
Yes, that is right.
So great. So here's a great question. How much does the technique of who does the CoolSculpting make a difference in the results if other people have the same device?
The technique is very important. You want to have somebody that's experienced, that knows how to assess tissue, that knows where to place the applicators. I have seen complications from other practices and they're kind of scary. So I do think it's important when you're dealing with your body to make sure that you go to somebody that is experienced, that knows how to assess the tissue and knows proper placement of the applicators, because there can be complications. Absolutely.
Absolutely. Desiree, do you have anything to add?
Yeah, I was excited when she was talking, because I think that is one of the biggest things that is so amazing about this pricing is you're able to go to someone with 14 years experience. I mean, that's more experience than I have working with it. So you're going to a master CoolSculptor and saving up to 50% on treatment packages. That's huge. So she has the eye of a master. She can do treatments that really, really address your concerns. And I mean, the results speak for themselves. I mean, this is only a fraction of the stuff that she's done. I've seen her in person with the patients. They all come back. They're all repeat clients. So I know that the fact that you're able to get those amazing results, but be able to pass the pricing on to you is really, really huge and exciting.
Yeah, I love that. Can you do CoolSculpting above the knees?
Yes. Yep.
Yeah, that's a really tough area that we treat with CoolSculpting, and we have a couple other treatment options for that area too, right?
So I believe liposculpture can be done there. And then of course, a lot of times we combine it with skin tightening technology. Yeah. So if we can tighten and lift in the thigh area, it will help reduce the appearance of what a lot of patients see as subcutaneous tissue.
Mm-hmm. So someone's asking, how does this CoolSculpting compare to Emsculpt?
CoolSculpting cannot be compared to Emsculpt because CoolSculpting is what we use for the subcutaneous tissue. So maybe it's CoolTone versus Emsculpt.
Okay, maybe.
Yeah. Maybe.
So how would those compare
to that?
I mean, they're essentially the same thing. It's magnetic muscle stimulation. So really the benefits of using CoolTone versus Emsculpt is you get the Allergan portfolio. So it was really developed around CoolSculpting to give patients that next level of result after they get rid of the fat. Now let's build the muscle. And then you also, because you're staying under the Allergan portfolio, you get to accrue those points and rewards. So, and I think the other thing is for Allergan to put their name on a system and on a technology shows that it is gonna give amazing results. And we know it went through all the FDA clearances to show that the patients are gonna be safe. So I think just those things alone can differentiate between an independent brand.
Yeah, great point, especially with all this like package combined pricing and all the alley promotions that you guys offer. All right, so does anyone have any final questions? If not, what should they do next to schedule a consultation with Leysin? Well, it is after hours, so our phones aren't being answered anymore, but I am going to pop a link in here for anyone to set up a consultation with Leysin on your own time in the evening. So anyone is welcome to do that now. I will pop that in. So you could schedule a complimentary consultation with Leysin, which I really think is the best option. Come in, she'll do a full assessment and see, if you're a candidate for CoolSculpting and what the treatment recommendation is, as well as other complementary treatments that we might incorporate with it, because that's really the benefit that you're getting from all of Leysin's experience and coming to a center like Cosmetic Laser Dermatology. So. All right, any final words? Oh, someone asked me where the consultation link is. Here, I will send that in. Oh, Beverly's saying, do these promotions expire?
No. Not at all. We're excited to be able to offer this. We're part of a pilot program, so these promotions will not expire.
Yes. I am excited, but I would say do them sooner rather than later because we do get booked up this time of
Yes.
summer. I mentioned July and August are super busy for all these body
Yes.
sculpting procedures. And, you know, we do have 2 CoolSculpting Elite devices, so we can treat 2 areas at once. So if you want to get in and have both of our machines working on 4 areas, we've got to block out that room for you for many hours. So please, the sooner the better to come in for your consultation. All right. Oh, she said, I love your answers. Thank you. Well, thank you all so much for tuning in live. We know you're busy, but we hope this is really helpful to kind of educate about CoolSculpting and what's changed and this new program that we're really excited about. And we're hoping that it kind of made it more affordable for everyone to try because we all deserve, I mean, that picture of that little muffin top over the jeans. I mean, makes me, I want to get that done, right? We all have that. So, you know, don't be ashamed. There are devices and technology out there, and this is very safe, you know, and Leysin is the master, literally the master of CoolSculpting to come to. So thank you, Desiree, for joining and sharing all of your expertise. Thank you so much, Leysin, after a busy day of patients and doing procedures. And we can't wait to see you guys in the office. So please schedule online using that link, or you can go to clderm.com. And we can't wait to see you in the practice and see if we can get you one of these 50% off discounted CoolSculpting packages. All right. Thanks, guys.
Bye.
Bye.
Thank you.